Welcome to the most important side event at WHA. My name is Kate O'Brien. I'm the director of the Department of Immunizations, Vaccines, and Biologicals at the World Health Organization. I welcome all of you to this interesting panel and what I hope will be an active discussion to the degree that we can. Clearly a lot of interest, a lot of people in the room. This will be an important discussion. We're going to be talking about promoting vaccine confidence, enhancing global immunization efforts to protect the health of all generations. And this affects, as we know, vaccines are the broadest, deepest primary health care program that we have around the world. And we're all in this together, especially because pathogens don't recognize borders. So this is a topic that is critical for every country, every family, and every community around the world. We have a fabulous panel here, and I'm not going to take more time because I think we want to hear from the panelists and hear from you as well. So let me take the opportunity to turn it over to Secretary Azar from the United States.
Excellent. Thank you very much, Kate. Fellow ministers, distinguished leaders, thank you for joining me at this important event. I'd also like to thank in particular the European Union and Brazil for co-hosting with the United States. Unfortunately, there is no better time than the present for us to come together to discuss how to make better use of vaccines. Vaccines are some of the most thoroughly tested medical products that we have. Vaccines are safe, effective, and life-saving. But around the world, complacency among the public, coupled with misunderstanding and misinformation, is causing vaccination rates to decline with tragic results. Misinformation comes from a range of sources. Insurgent groups in the Democratic Republic of Congo spread misinformation about the Ebola vaccine. Terrorists in Pakistan do the same, preventing children from receiving the polio vaccine. In my country, social media conspiracy groups confuse well-meaning parents so they hesitate to get the recommended vaccinations. This misinformation has real impacts. Consider the numbers that we have on measles. The WHO estimates only 85% of eligible children receive the first doses of the measles vaccine, while only 67% receive the second. As of April 15th, the WHO reported more than 112,000 confirmed cases of measles across all regions. In the U.S., we've seen more than 700 cases of measles just this year, the highest number since the disease was declared eliminated from the United States in 2000. But we can fight back, and you will find no government more committed than the United States to combating these challenges and strengthening immunization programs around the world. It is safe to say the U.S. supports in some way the national immunization programs of every low-income country through a variety of mechanisms, and that work extends to a number of middle-income countries as well. The U.S. Centers for Disease Control and Prevention provides technical support from its Atlanta headquarters, our CDC offices overseas, and CDC employees embedded in WHO and UNICEF offices. We provide technical and financial support for lab testing of vaccine-preventable diseases, and CDC serves as a global specialized laboratory for polio and measles. Through the National Institutes of Health, we generously support research on new vaccines for diseases such as Ebola and HIV. We also provide financial support for vaccine provision through a number of channels, including contributions to the Global Alliance for Vaccines and Immunization, or Gavi, which I would like to emphasize is a highly successful public-private partnership. Just recently, the U.S. supported a mass measles vaccination campaign in Nigeria that reached almost 10 million kids. We assisted with the diphtheria outbreak among Rohingya refugees in Bangladesh. We contributed to new research that found a 1/5 dose of yellow fever vaccine works as well as a full dose, which is important in the event of a shortage. At home, under my direction, the U.S. Department of Health and Human Services has ramped up nationwide education efforts to increase vaccination rates. Addressing vaccine-preventable disease has also been one of the top priorities of the U.S. response to the crisis in South America caused by the former Maduro regime's destruction of the Venezuelan healthcare system, which has allowed measles and other diseases to return to a region where they had been eliminated. All sectors and all nations, large and small, have something to contribute in turning the tide against vaccine-preventable diseases. I look forward to hearing from diverse perspectives today and to working with all of you in the years to come to make real progress against preventable diseases. Thank you for your attention today, and I look forward to our next speaker, EU Commissioner for Health and Food Safety, Vytenis Andriukaitis. Thank you.
Colleagues, the Director Katherine, the success of vaccination is well documented. It saves up to 3 million lives each year. Big success. It also offers important protection to the youngest and the oldest members of our society, to those most vulnerable to illness. It is a fundamental part of our public health systems. But I am not here to highlight the vaccine success story. Instead, I want to focus on what we as a public health community need to do better. We have become the victims of our own success. Vaccine works very well, but now we see different picture. As the incidence of vaccine-preventable diseases diminished in recent decades, the perception of risk also decreased. At the same time, citizens have become more concerned about possible side effects. Doubts developed about the need to vaccinate. And sometimes we reassure ourselves with the belief that we will get the appropriate treatment if the diseases do occur. Let me take measles as an example. To be honest, I am not sure that many people truly understand how dangerous measles really is. As a doctor, I have seen its impact at first hand, and we need to do more to prevent it. In 2018, more than 12,000 cases of measles and 35 deaths occurred in the European Union. It's very dangerous. This is unacceptable to me, since an effective vaccine against measles has existed since the 1960s. This disease should have been eliminated in the European region by 2000, according to the objectives established then by WHO. Instead, only 4 countries in the EU achieved the necessary target of at least 95% coverage for 2 doses that leads to herd immunity. Moreover, WHO recently outlined alarming levels in measles in the European region, taking into account EU and non-EU countries, identifying 9 countries in the area as priority and informed about their decision to scale up the response. Situations in several of them affect directly the situation in Europe. In this context, I will be awaiting with much interest today's intervention from Romania and Ukraine to better understand the causes and the ways to improving the situation. Individual decisions affect the whole population. If you want to eliminate a disease, if you want to protect those who cannot be vaccinated, that are too young, too old, or too sick, we all need to vaccinate ourselves. So how do we move forward from here? Well, confidence in vaccines is absolutely crucial. As European Commissioner for Health, I can speak to this. Currently, the EU is a region with the lowest confidence in the safety and effectiveness of vaccines. This confidence is influenced by a number of factors, including how important, safe, and effective citizens perceive vaccines to be, but also how health professionals and national authorities transmit the information. So we urgently need to do more to reinforce the truth about both vaccines and diseases. We recently conducted a survey across the European Union about attitudes and knowledge on vaccination. Some of the results are worrying. Let me give you a taste of the findings. 48% of European Union citizens believe vaccines can often produce serious side effects. 38% believe vaccines can cause the diseases against which they protect. 34% do not see the need to be vaccinated. And 29% think vaccination is only necessary for children. At the same time, the survey highlights where we need targeted actions, and it points to some solutions. For example, it shows that citizens trust healthcare workers and health authorities to provide them with information and advice on vaccines. So we need to support health workers and empower them so that they can build on this trust. They are the front line when it comes to vaccination. The Coalition of Health Workers for Vaccination at EU level, which we recently established, recognizes this. It looks to strengthen the engagement of healthcare professionals and aims to increase vaccine acceptance and counter vaccination myth. The survey also shows that the majority of citizens have a positive attitude towards vaccination, so we need to reinforce these positive perceptions. Colleagues, the ball is in our court. And high-level side events like this one prove that the political will is there. Now we need to turn that political will into concrete actions. Thank you.
Let me now introduce the Minister of Health from Brazil and welcome you, Dr. Mandetta, to give us some insights.
Well, thank you very much, but I'm going to speak in Portuguese so that you can all have a taste from Brazil. Esse fenômeno mundial, aqui tão bem realçado pelo comissário europeu e também pelo meu colega Alex dos Estados Unidos, ele é multifatorial e ele é multicultural e ele ocorre nas diferentes sociedades por diferentes motivos, desde a falta de um sistema estruturado ou da própria aceitação de que as percepções coletivas podem, em algum momento, ter algum tipo de fundo de verdade, principalmente quando as mídias sociais, que têm um papel tão importante para a liberdade, para direito de expressão, quando elas são mal utilizadas como instrumentos de fake news que trazem sistematicamente questionamentos sobre as vacinas. Eu começo discordando do meu colega americano, do Alex, que disse que não há nenhum país mais comprometido que os Estados Unidos. O Brasil está tão ou mais comprometido que os Estados Unidos. Nós já iniciamos uma campanha logo no início desse ano por conta desta crise sem precedentes, dessa diáspora venezuelana, de onde já saíram mais de 3 milhões de venezuelanos daquele país, com um sistema de saúde que entrou em colapso junto com os demais sistemas venezuelanos. E, ao entrar em colapso, rapidamente, também por baixo índice de vacinação, nós tivemos uma epidemia de sarampo que entrou na divisa da Venezuela com o Brasil, no estado de Roraima, e rapidamente chegou a Manaus, que é a capital do estado do Amazonas, uma cidade extremamente populosa, onde nós tivemos quase 10 mil casos. Foi um esforço muito grande para controlar esse surto em Manaus, e doravante nós iniciamos não só uma campanha de vacinação através do Ministério da Saúde do Brasil e do nosso Programa Nacional de Imunização, mas nós instituímos um movimento nacional pela vacinação. E esse movimento nacional, ele teve alguns momentos já de repercussão nacional e internacional, quando, numa parceria com a cidade do Rio de Janeiro, nós iluminamos o Cristo Redentor, que é um dos nossos maiores cartões postais, com essa camiseta, que depois eu vou presentear um de vocês, do nosso movimento pela vacina. Nós estamos fazendo um enorme esforço, o Instituto Butantan de São Paulo já trabalha na fase 4, esperamos que no próximo ano nós possamos apresentar a vacina de proteção da dengue com dose única, com quase 86% de cobertura de proteção para uma doença que aflige inúmeros países aqui presentes. Na Fiocruz, no Rio de Janeiro, nós iniciamos a construção de um complexo industrial para a produção de vacinas, porque nós percebemos uma diminuição de centros de produção de vacinas e imunobiológicos e deveremos trabalhar nos próximos anos procurando parceiros internacionais para que nós possamos ter uma garantia de um padrão de qualidade em vacinas elevado e segurança para que as pessoas possam, através da Fiocruz, ter a credibilidade suficiente para que nós possamos fazer a mais moderna fábrica de produção de vacinas e imunobiológicos das Américas. O Brasil trabalha fortemente e fomos também proponentes desse evento, talvez por imaginar que na vacinação seja o nosso ponto de encontro de quando discutimos cobertura universal ou sistemas universais. A vacina tem que ser universal e a vacina tem que estar na agenda de todos os povos do mundo. Ela é um patrimônio. Isso veio de Jenner, isso veio de Sabin, isso veio de Salk. Isto não tem partido, não tem pátria. Isso pertence às crianças do mundo. E enquanto o mundo tiver crianças que precisam de vacinas, nós não podemos deixá-las à mercê de especulações fantasiosas sobre vacinas. Nós tivemos, os pais dessa atual geração não sabem o drama, talvez chamar os avós, chamar os cabeças brancas, para que eles possam dar o testemunho do que era o sarampo, do que foi a poli, das milhares de vítimas que o mundo assistiu e de tristezas que ocorreram. Nós estamos juntos com todos vocês, juntos com os Estados Unidos, com a Comissão Europeia, preparados para, juntos, liderarmos uma grande campanha mundial a favor da vacina, com a credibilidade daqueles que podem falar sobre vacina, sendo verbalizado o mundo afora. Essa é a posição do Brasil.
Thank you so much. We're going to move on to the two panel topics. The first topic is on challenges.
Here's the T-shirt. Let's give it to delay.
Okay, it's a challenge. It's a challenge. The first topic will be the challenge for vaccination worldwide. And we'll have two speakers, then some questions, and then we'll move on to the second panel topic. So the first speaker is Dr. Peter Hotez, who I'm very honored to introduce from the Baylor College of Medicine, National School of Tropical Medicine. So Dr. Hotez, please.
Thank you so much, Dr. O'Brien. I'd like to make a few remarks this afternoon in which I bring a unique perspective to the vaccine confidence discussion. I'm a pediatrician scientist who develops new vaccines for the poverty-related infections known as the neglected tropical diseases, and have had the good fortune to collaborate for decades with the World Health Organization on both our vaccines and the global governance to control or eliminate these conditions that literally affect more than 1 billion people in the world who live in poverty. But with my wife, Anne, we're also the parent of 4 adult kids, including Rachel, who is now a 26-year-old woman who has autism and significant intellectual disabilities. And the reason why being an autism parent is relevant is that a major basis for vaccine hesitancy in both North America and Europe, and now moving globally, is the false assertion that vaccines cause autism. And in response to that, I've written a new book called Vaccines Did Not Cause Rachel's Autism, which, as you can imagine, is putting me in the witness protection program. But it tells a personal story about Rachel's life and challenges finding employment and mental health counseling, but also it's a book that does a deep dive into the science of both vaccines and autism. It details studies on over 1 million children, reporting how children who receive their vaccines are no more likely to become autistic than children who are not vaccinated. Conversely, it also summarizes the evidence showing that children on the autism spectrum are no more likely to have been vaccinated than children not on the spectrum. It goes step by step, refuting each of the major false claims, showing that MMR vaccine does not cause autism, as was first alleged in 1998, then showing how thimerosal preservative, now removed from many vaccines, also does not cause autism, nor does spacing vaccines close together cause autism, nor does aluminum adjuvants in vaccines cause autism. So we're in this kind of Pyrrhic game of global health whack-a-mole where we knock one down and another one pops up, and each time the scientific community responds. I also go into depth explaining how autism occurs through the action of more than 100 autism genes expressed in early fetal development, and how through whole exome sequencing we've now identified one of those genes in Rachel, encoding part of the neuronal cytoskeleton and neuronal connections. The point being that autism begins in early pregnancy, well before a child ever receives the vaccines. And then I go on to debunk other false claims made about autism and refute statements that vaccines cause teenage depression and suicide or autoimmune disease, or there are toxic ingredients in vaccines. As you might imagine, the book and subsequent media interviews have put me and my family on the front lines of the vaccine hesitancy discussion and have caused me to sometimes have difficult discussions, even a few public confrontations, with individuals who passionately believe that vaccines injure children, or even that autism itself is nothing more than a form of vaccine injury. So what do I say to worried parents? My major points include the simple truths that vaccines represent one of humankind's greatest achievements, responsible for the eradication of smallpox, the near elimination of polio, and dramatic declines of deaths from measles and other killer childhood infections. I write and speak about how, as a pediatric house officer on the Children's Service of the Massachusetts General Hospital during the late 1980s, I went from taking care of a terribly ill or permanently impaired child from Haemophilus influenza type B meningitis on a weekly or monthly basis to personally watching this disease disappear from America, so that today we mostly talk about Hib meningitis purely for historic interest. I also point out, however, that our public health victories achieved through vaccination are fragile, so that vaccine-preventable diseases can return if vaccine rates decline. We've already heard this to be true of measles, because the measles virus is so highly contagious, particularly for infants under the age of 12 months, not yet old enough to be vaccinated. In 2017, I wrote in the New York Times how measles could return to Texas and other states where we've had a steep rise in parents exempting their kids from vaccination. Then in 2018, in the Public Library of Science, we identified 15 urban hotspots where kindergartners are not being vaccinated. So far in 2019, measles has returned to 7 of those 15 sites. Today in the United States and Europe, there's no reason why measles or other vaccine-preventable diseases should be allowed to return. And I know the leadership of the Department of Health and Human Services and CDC feels the same, and look forward to working together with them on this front. Ultimately, we need to reinforce the message of vaccine safety and remind parents there's a lot of misinformation out there. They dominate the internet, at least 480 misinformation websites, to be exact, 480 misinformation websites, all amplified on social media, as well as e-commerce platforms that promote dozens of fake books alleging phony autism links and other false assertions. I love coming to the World Health Assembly. Here I meet my public health heroes, like the ones that you see in front of you today, committed to vaccinating the world's children and ensuring the safety of our global vaccine supply. Right now in 2019, vaccine hesitancy is a looming issue, and one that could threaten the extraordinary progress since Gavi, WHO, UNICEF, and HHS federal agencies recommitted to vaccines almost 2 decades ago. But I have great confidence in our leadership to ensure that this will not happen, will ultimately achieve important disease elimination targets in the coming years. Thank you again for this opportunity.
Thank you, Peter. Let me now turn over to Professor Dr. Rafila from Romania.
Thank you very much, and I want to congratulate you for being sponsor, second sponsor of this event. But I changed a little my mind, because at the beginning I want to have a more technical presentation, but now I see the opportunity to change it a little in a more political one, because 10 days ago we organized in Romania a dedicated workshop on immunization. On hesitancy was the purpose of this workshop, and we had some very interesting conclusions at the end of this workshop organized during the Romanian presidency at the European Union Council. I will start a little with the situation in Romania regarding measles, because we are facing an epidemic since the beginning of 2016, and we already have more than 16,000 cases, and what is very difficult to accept in these days, it's more than 60 person died. And some figure I want to present to you, and I think it's one of the best evidence that immunization it's the response to prevent measles, is that 95% of the person who were infected were not vaccinated, and only 1.2% of this person were vaccinated with the complete regimen of 2 doses of measles vaccine. So it's a very, very clear conclusion that vaccination is that one which will stop epidemics. And another thing, which is also very unpleasant, very dangerous, is that most effective were children below 1 year of age, which were not vaccinated because they didn't have the age, but the incidence in this case was when the peak of the epidemics was 900 to 100,000 inhabitants from this group. So we discuss about exposure of children to this illness, and subsequently we had this number of deaths. And now I will turn a little to these conclusions we had about after the end of this meeting. And the idea is that recognizing that vaccination is a cost-effective public health intervention reinforces the wisdom of prioritizing investment in immunization program by national governments and international organizations. The second, it's very important, it's this political commitment to immunization. It's the key to realize its full potential to protect health and fulfill its crucial role in helping to achieve 14 of the 70 Sustainable Development Goals, thereby reflecting the ethos of SDGs of leaving no one behind. And the ongoing measles outbreaks and associated deaths are a serious concern and indicate the presence of pockets of suboptimal vaccination. How to address this? Maybe an approach, a community-based approach is the answer. And also another proposal is that we should develop dedicated training programs about vaccine and vaccination to healthcare providers and students from medical university in Europe and everywhere, because the trust in health system, the trust in healthcare providers, it's essential in many countries, and this is the way in which we can increase confidence. And there is something else we discussed there. It's not in this conclusion, but we already discussed. In my opinion, my personal opinion, it's we should address it. Developing programs, education programs for vaccination of adults will improve coverage of vaccination in children, because vaccination is something which should benefit everyone during his whole life. And if we'll succeed to educate adults regarding vaccination, for sure the impact on vaccination of the coverage of vaccination of children will be, of course, very much improved. Anyway, multilateral collaboration between countries should be further enhanced in sharing best practices on implementation of national vaccination plans on program, and of course, the support of international organization and agency. It's essential, and I want to thanks to WHO Regional Office for Europe and also to European Center for Disease Control in helping Romania to finish with this epidemic. Thank you very much.
I do want to ask the Director General of Public Health from the Ministry of Health in Ukraine, who's here, to say a few words about the current situations with measles outbreaks and actions being taken to increase vaccination rates. Thank you.
Madam Chair, ladies and gentlemen, there is this huge measles outbreak in Ukraine. Over 100,000 cases have been reported since the summer of 2017, over 40% of which have been adults. 38 people died. This is the result of years of anti-vaccination propaganda, disinformation and lack of efforts by the previous administration to dispel these myths and fakes. In 2014-2016, a lack of supply due to difficulties in procurement and delivery of vaccines because of external aggression against my country took its toll as well. At the moment, we are able to procure enough vaccine, either for routine vaccine immunization and catch-up campaign for those children that skipped immunization in the past. But we have found another challenge, that some parents had purchased fake vaccine certificate, and in one regions alone, medical records showed we needed to vaccinate additionally 21,000 children, but review of true certificates revealed that the number was closer to 50,000. Our analysis of vaccine refusal has shown that parents may well support vaccination, but often the grandparents are the ones taking the kids to the physician. And we have now started informational campaign targeting grandparents and the caregiver population. In addition, we found the large adult population that had been vaccinated in the 90s and early 2000s, but did not develop immunity. We have been told by WHO immunization expert that this is likely due to poor quality of vaccines procured at that time, combined with the problems with the cold chain. We would appreciate advice on how to solve these problems, as this is approximately 15 million additional vaccinations necessary. Ukraine has been also facing the challenges with collecting information on vaccination coverage at the temporarily occupied territories. The lack of information formed their new myths and disinformation and required joint efforts through effective health cluster led by WHO. Social media becomes the new source of information where parents looking for answer and solution even more often than asking their physician. At the same time, unfortunately, this is also a place where fake news and misinformation can be shared easily and widely. We call to jointly find the solution to this new challenge. And finally, we would like to thank to WHO, UNICEF, the CDC Global Immunization Team for their help and assistance. And we would like to reconfirm Ukraine's commitment to the Global Vaccine Action Plan and its further elaboration. Thank you.
Thank you. So the first question I'd like to ask is to you, Secretary Azar. In light of the recent measles outbreak in the United States, can you tell us about domestic measures that are really critical to take in the near term, and what needs to happen over the longer term to reduce the likelihood of having these outbreaks again?
So it's just heartbreaking to see a resurgence of measles in the United States. It's a disease that had been effectively eliminated from our country, and it's reemerged with at least 839 cases in 23 states. Measles is a preventable but highly contagious disease, and the best way to prevent measles is with a safe and effective vaccine, which we have. So what are we doing to increase and to take action and increase awareness? First is close collaboration with all sectors. So we are reaching out and working with state and local health departments, with healthcare providers, very importantly religious leaders, because some of the misinformation is actually coming through religious leaders, and other stakeholders such as social media companies and search engines as they try to prioritize accurate science-based information rather than misleading disinformation. We've also taken advantage recently of National Infant Immunization Week, where we sent all of our top officials on TV around the country, making it clear that it is the scientific expert opinion in the United States that these vaccines are safe, and that individuals should talk to their physicians about getting themselves or their children or their grandchildren vaccinated. Part of that is leveraging parents and encouraging that physician discussion. Talk to your physician. Talk to your physician. If you have a loved one, the role of grandparents can be vitally important here. Grandparents who actually might remember measles and people dying of measles and other infectious disease. Parents may not, but grandparents may intervene. And we've just got increased risks about importing measles. And so we're ensuring that people understand the risks of travel into areas that might expose one to measles and the need perhaps to get a booster shot if you're going into an area. Ensure your immunizations are up to date before doing that. So thank you.
So thanks for the sort of description around the actions that people can take. But I'd like to turn to you now and, Commissioner, ask you maybe about something a little bit different, which is how you think the quality of services and the training of frontline health workers and the availability of vaccines, so more the supply side, impacts on exactly what we were hearing about in the U.S. on the demand side. Are there some solutions that you'd like to highlight on that sort of more supply side end?
Thank you. Your question shows that we are facing very complex issue, multi-faced, and because it includes supply, knowledge, access, and fear. Fear, you know, you can see a lot of people who have fear about vaccination. I think the recent Eurobarometer survey highlights some important areas that require focus. A large majority of citizens, 79% consent and trust healthcare professionals to get information about vaccination. And healthcare professionals play crucial role. No doubt. And of course, we need to strengthen the expertise, training, and engagement of healthcare professionals, starting from universities and finishing with those who are practicing every day. This is crucial, and it highlights an obvious way forward. We need to strengthen the expertise, training, and engagement of healthcare workers, and of course, we need to help them to be prepared. In many of the areas we surveyed perception of diseases, perceived effectiveness of vaccines, reasons for getting vaccinated, knowledge about vaccination, the effect of vaccines. Health workers play a crucial role. And of course, I think that now it is very important to educate healthcare practitioners on everyday basis. For a simple example, if you ask patients, today we are going to be vaccinated your child. Is it more effective than how do you feel about vaccination? Simple question. How do you feel about vaccination? Absolutely different approach. But of course, if we are more friendly and showing that we are ready to help your children to be vaccinated, it's a little bit different. This seems like a subtle difference between simple exchanges like this can have a significant impact on vaccine uptake. We are also taking practical steps. The European Center for Disease Control has produced communication guides and toolkits to help health professionals change behavior. And of course, our coalition of healthcare workers to help us once again to encourage our healthcare practitioners to stay together and to build network of practitioners helping us address those issues. Of course, it will be good to listen to the audience of your experiences on this very complex questions. Thank you.
So in order to have more time at the end for more discussion, I'm going to move on to the second panel. And the topic here is the state of the globe, the role of misinformation and revitalizing information and education on vaccines and vaccine confidence. So let me first introduce Dr. Theresa Tam, the Chief Public Health Officer of Canada. Theresa.
Thank you very much, Kate, and I'd like to thank the US, the European Union, and Brazil for putting this panel together. And I certainly share concerns with the other panelists on the reemergence of vaccine-preventable diseases and the need to promote vaccine confidence. In Canada, we have less than optimal vaccine coverage, but the coverage is pretty high. Still. Only about 1.3% of parents have never had their kids vaccinated. So we know that there's quite a large and a vast majority of parents who believe in vaccination. So we're looking at pockets of under-vaccination. As we all know, you've all got your cell phones, and all of us look online for information when we need to know about something. But the problem is sifting through mountains of the information and not knowing where that information comes from. And seeds of doubt can be sown very rapidly by these sources. And so what we know is that online information can have very significant real-life impacts and consequences, some of which you have heard. And it's not just a domestic issue, but it reverberates globally. And something said in Canada can result in a negative impact in another country, for example. So as the Chief Public Health Officer of Canada, I actually made vaccine hesitancy a priority. And just recently, I saw an opportunity to really escalate this issue because we had a cluster, which was actually very tiny. So it was like 14 cases in British Columbia. That was enough to ignite significant public discourse and journalists' interests. So I took that opportunity to just call all the social media platforms because I thought, well, if not now, when? So I sort of picked up the phone and called Twitter and Facebook and Google and that type, all of these companies. We also did a analysis just on the Twitter platform to show what's actually going on. So what we found is that, as many of you might have also seen, a very small number of individuals actually do every day, every minute is spreading misinformation in a massive way. So on the map, you see all these lines going over the place. It's just a few people. The Public Health Agency and maybe other public health organizations have a tiny footprint. You know, we're not connected, we're not spreading things around very well at all. And there are bots at play. So bots are retweeting things blindly, essentially, and spreading information. So that's our situation when we looked at it. And so, so I called together this social media group, but at the same table are parents who've had lived experience with vaccine-preventable diseases or have changed their minds about vaccination over time. I invited parenting experts who are parent influencers, educators, and obviously experts, but also journalists, to have a really good discussion. Well, what can we do? And so, but the first thing was that we recognize we have a common goal, which is the health and well-being of children. Everyone has the same goal. And trust is the underlying issue. And so in order to rebuild trust between parents, individuals, and their health care providers, we need to build environments where parents actually feel that they're heard and that their questions are going to be addressed. And the panel that I pulled together highlighted new forms of online media engagement. We need to up our game, basically, as public health people and get engaged in more novel ways, and science literacy, science and digital literacy. So digital literacy begins by realizing that the information online is created by someone with an agenda, someone with an objective. You need to know who made it and why they made it. So some of these fundamental questions need to be taught to kids at school or to parents or grandparents who didn't grow up in this internet age. So we are working with Twitter on an initiative that will have users presented with accurate information on vaccines if the user searches certain hashtags, such as vaccination or anti-vaccine or those kind of things. Then the Public Health Agency's website pop up. I know that they've done similar initiatives with other entities as well. We've also had a discussion with Facebook on how we can collaborate on removing information that has been scientifically disproven or debunked. So Facebook is currently working with the WHO, with the US CDC, and essentially trying to work with us to, so they'll need some experts to actually say, is this misinformation? If it's scientifically proven to be misinformation, there's an opportunity for them to actually remove that information. And we're also working with Google and others. And so I think that a lot of people criticize social media companies for not doing enough, but I think that we're all trying to figure out what more we can do together. So another thing that I thought about is a coalition of public health partners so that we can retweet and read forward our collective information in the same way that the anti-vaccination group has been doing. And this could be an international collaboration as well. We need to collaborate across government departments because there are other government departments sort of interested in impacts on the elections, impacts on combating extremism, for example. And we can't all go to these social media platforms left, right, and center. We need to have a more cohesive approach. And so the government of Canada invested $25 million just recently to increase vaccination coverage rates. And we set up this fund called the Immunization Partnership Fund, and in order to identify the pockets of under-immunization, in order to have much more targeted interventions, because we realize that in the Canadian context at least, these small pockets are all very different. Some of them are religious communities that need their questions answered in a certain way. Some of them are schools with parents who believe in a certain perspective. And so another project that I thought was interesting to just highlight finally is a project called Kids Boost, or Kids Boost Immunity, started in BC. It's a school-based online platform that uses gamification, so turn it into something fun for learning to raise student literacy around the importance of vaccines. And the winnings that they get leads to vaccines being donated to UNICEF. And this is really caught on. So as of September 2018, nearly 2,300 students earned over 21,000 vaccines for UNICEF. So there's lots of different innovative ideas that we're hearing, and maybe the key is to sort of collaborate on lessons learned and maybe some of the innovative ideas. Thank you.
Thanks, Dr. Tam. I'm gonna zoom down now to the other end of the table. Welcome Dr. Seth Berkley to the panel, who's the CEO of Gavi, as you all know. And Seth, I wonder if you could speak a bit about, again, sort of moving on to the system side, the building of strong health systems, and especially as that relates to access and high-quality services, particularly in fragile settings or conflict settings, some of the most difficult to reach, and this sort of link between the service delivery and demand.
So thanks so much, Kate, and let me add my thanks to the groups that organized this. This is a very important topic, and let me apologize for being a few minutes late due to a competing priority. I will get to your question, but let me just start. First of all, I heard since I've come in that increasingly people are using safety concerns or side effects as a base for vaccine hesitancy. And frankly, you know, there is a scientific consensus, a very strong one, about the safety of vaccines. And we need to make sure that we can keep coming back to that. Now, the work we do at Gavi is focused in the developing world, and we didn't used to have a lot of problems with vaccine hesitancy because, frankly, people saw the diseases every day. People saw people dying in their family, in the community. They saw the side effects. Of course, now, with the incredible success in vaccination, they're beginning to see less disease. And so, in a sense, the disease that we're talking about here can spread to them as well. And we have to think of it as a disease. This is a disease. The Secretary has already talked about how measles is so infectious. This spreads at the speed of light, literally. We've talked a lot about how this happens. So, you know, starting there as a critical issue, and we've seen the effects on the world. Second point is that, you know, the pro-vaccine voices that exist in social media, the excellent work that Canada has just talked about, the challenge is that they are being drowned out on social and digital platforms by the high visibility and engagement of the anti-vaccine community. And the point here is that, you know, this is not about each country having their own work. This is about this spreading globally. And so we have to keep in mind, even more than infectious diseases, and of course there are no barriers to infectious agents, there are no barriers to this information. And so, you know, the algorithms are favoring sensational content over scientific facts. We're seeing this from, you know, from India to Kenya to Nigeria. We're seeing this happen, and it's not just in the standard standard social media platforms. So we, like others, have reached out to the platforms, but WhatsApp, for example, which is a private messaging platform, not the standard social media platform, tends to be the tool that is used to spread this information. Now, there are solutions to that, and as we've talked to companies, there's all kinds of cool new technology. We just heard the other day about one called CrowdTangle, which allows social media companies to begin to look at where rumors come from, trace the source of them, and understand them. But to do that, we have to have the ability to test and have trusted people on the ground to say to us in these closed systems, what are they hearing? I must say I'm worried about how we have continued people. I mean, it's more than 20 years since Andrew Wakefield was discredited in the UK. He was a great export to the U.S. He set up shop in the U.S., and he's continued. And we've seen now actual outbreaks that have been linked to his advocacy. Those outbreaks have not only been in Minnesota, where he advocated against measles, but those spread to Sweden, and we think also to Somalia, although we don't have the data to be able to do that. So this is a real challenge. The challenge for me is misinformation is the toolbox, and there's now commercial drivers of misinformation. You make money through the clicks towards that misinformation, and also, this is the really scary one, there's a political side now. You can destabilize governments by having both positive and negative information, which means that you confuse the population on, can we trust our governments or not? And that is now happening, and it's being accelerated by machine learning, AI, et cetera. So now, to get to the point that Kate asked me, our role in the developing world is to strengthen demand in general and to think about how we can build more capacity for local leadership. Because at the end, it's local leadership that will fight back against this epidemic, but we also need to try to stop the epidemic. Otherwise, you're not doing your job as a good epidemiologist getting rid of the problem. So we need both. And to Kate's point, one of the critical issue here is to build strong health systems that allow all the way down to the frontline worker, whether that's a community health worker, whether that's working with village leaders, religious leaders, being able to have the correct information so that when these campaigns start, you have an ability to reverse them early and to have that type of trust be able to be done. For me, one other point I'd say is that we've talked a lot on the panel about social media. We've talked a lot about trying to stop the bad messages. The issue is going to be not only trying to stop those bad messages, but to have positive messages. And it can't just be governments, because some places governments aren't trusted. So how is civil society, how are societal leaders, how can we get a drumbeat of positive information that is there and not drowned out by the vaccine misinformation that's so critical? So in my discussions with social media leaders, that's my request, to be quite specific, is to go ahead and try to stop the misinformation, take it off the air. I remind people that this kills people. It's like other misinformation. This actually has a real cost. It's not a freedom of speech issue. This is wrong information that's killing people. And then how can they help us be part of the solution and not just part of the problem? But to Kate's point, that has to extend all the way down to the health system. There has to be quality. People have to trust that system, and if they don't do that, that will also flame the fires that are currently going on. Thank you.
Thanks, Seth. That really touched on a lot of the sort of key issues that I think we're all struggling with, and new actions that need to really be sort of brought on board so that we connect up and are limiting the misinformation that's out there. A couple questions for the panel, and then I'm going to open it up to the floor, so get your questions ready. And I'll ask the panelists to try to keep your answers as brief as possible so that we can get to the floor. So first for you, Dr. Tam, a number of vaccines, a number of vaccine-preventable diseases, we clearly have the technical tools to be able to either deeply control, eliminate, or eradicate the pathogen. But the issues that limit the greatest impact are not really technical. They're, as we've been discussing, social, political, financial, managerial. So can you think of how we could strike, how we could ignite a stronger social movement around vaccines that could be sparked, and a way to root vaccination as a stronger social norm, especially in the generation that will be parents in the years to come. Perhaps that's where we should be focusing more of our attention.
Thank you for this question. I think getting behavioral insights is an extremely important aspect of public health, because we have to try and get populations to change their behavior. That's what public health does. And so I don't think we've been leveraging behavioral science and analytics in order to address some of those fundamental issues, which is, as you say, not biomedical, but people's beliefs or interpretation and distrust. So I think one thing that people have already touched on is that it is a social norm in many countries, and that over 90% of parents in many of our countries do believe in vaccines. So I think we need to leverage that 90% and give them a voice, so that the small number of people who's trying to say there is a debate when there is no debate, it's a tiny group of people shouting really loudly, whereas the rest of the population is actually on board. So making sure that is realized, it is a social norm, people do get vaccinated, is very important. I do think that people, as I said, the Canadian public may not listen to me, but they'll listen to parent influences. So we're trying to leverage those people. And in our last National Immunization Awareness Week, we actually did that, and that really worked. Our messages got out through those channels much better. And also, I think youth influences. So we've seen some youth questioning why they didn't get vaccinated when they were younger. It's beginning to dig out information as well. I talked about, you can't start too early. So the program that we talked about, education at schools, I think is really important, and start really early. I also am quite concerned about the medical professions or the healthcare professions, and then all the other allied health professionals not actually that well educated because they haven't seen the diseases themselves. So whether you're a chiropractor or someone else, you've got to get trained in vaccines and vaccine preventable diseases. I think one thing that the social media platform said to me was, you got to get into the trenches of Twitter and start responding and start getting engaged so that people feel that there's a person behind that government voice, and begin to get engaged much more on a personal, emotional level because people don't understand statistics and data. Like, if you start doing that, you've lost them. So I think, but the bottom line is to listen, because to engender trust, and this is behavioral science, is that you need two things: competence, so you need to know knowledge, and care. So that, so we actually have also support a program on motivational interviewing. I think some of you might be familiar with it, and we're doing a program in Quebec right now where this motivational interviewing is being done in maternity wards, where the mom isn't getting the kid vaccinating that day. That's too late. You get pregnant mothers delivering babies undergoing the motivational interviewing, and that nudges them to get their first vaccine on time and then further along. So these are just some ideas.
Thanks, Theresa. Next question is for Minister Mandetta. Theresa really talked about this complex local social environment. And so just turning to a different direction, which is there a way, how can we effectively influence political and social leaders to commit more to sort of bold, galvanizing, world-changing moonshots, whether they're elimination or eradication, or even just an agreement on some true commitment and authentic commitment to the control goals? Are those the sorts of cross-national goals that just are not possible anymore, or do you think that's still out there?
Yeah, they're still out there, and I think that this has been said here by our colleagues, Berkley and others. But maybe working with a minimum number of vaccines that could be obligatory for people to travel, for people to take their passports. I have here 3 congressmen from Brazil in this room, and I'm asking them to run some laws for our kids to go to school. And how are we going to deal with that? The individual right versus the public right. How to deal with all those fake news and this internet. Is this something harmless? Is something that they do just to express their opinion? Or is this like a kind of biological terrorism that is being done because it causes death to people? This is something that all Congress in the world should make their discussions and try to find ways. We should have it mobile. We cannot, maybe we could do this mobile so that people all around the world would have their records on vaccines and they could travel. Because on paper, this is something that it's almost impossible for someone to find it and to show it and to keep it with them. So I think that this has got to be done by a campaign in the way that people said here, with elders telling what happened. I have friends of mine, I was born in 1964, I have friends that had polio. They are there with all the troubles that polio brings for a kid, for an adult. And I think that they are the ones that have to say, and maybe the World Health Organization should be the one to hold the campaign, because it has this world abroad performance to talk about it.
Comments. One is, we've talked about health. You know, this is not a health problem. This, in a sense, is a whole of government problem, because we need to engage local telecommunication ministries. We need to think about defense if it turns out that there is, you know, trying to create instability, home ministries, local government ministries, communications, et cetera. So I think it's important to not just pigeonhole this now as a problem. And the contrary-wise of that, I want to say that what we need is a movement that, in a sense, goes almost beyond immunization. It's linking immunization to being a good parent. It's having people understand that value. And the reason I say that, it's very interesting. We work with private sector partners, and one of our private sector partners is a large company. I can say a Unilever, who's working on selling things around the world. And when they began to test things, as they do, because they have very good marketing systems, the traditional things weren't as valuable as having parents feel pride that they are doing the right thing for their children. And I think that's the type of proactive campaigns we can do to make it a societal norm that, in fact, if you're not immunizing your parents, you're a bad parent. I mean, your children, you're a bad parent. And if you are, you're doing something that protects them for life, that builds their, ability to contribute, et cetera. So I think there's a lot that we could do with that in terms of trying to make this a social movement.
I don't disagree with your slip of the tongue, which was maybe you're also a bad parent if you're not immunizing your parents. But yes. Peter, please. And then we have one more hand. We probably have time for 2 more questions. So 1 and 2. Thank you. Peter.
Thank you. This has been a great discussion. And one of the other challenges and big ideas that we have to think about, in my remarks, I focused a lot on the measles vaccine and declining rates in the U.S. and the anti-vaccine movement. But the anti-vaccine movement now, I see, being out there in front, defending vaccines, is drawing a new line in the sand. And the new line is around the introduction of new vaccines. That seems to be the next big battleground that I'm seeing. We're already seeing with targeted aggression towards the HPV vaccine. We're seeing, terrible uptake rates in parts of the United States where only half of teenage girls are getting vaccinated. We're condemning a generation of women to cervical cancer. I think we're going to start to see it now, where I'm seeing a lot about the malaria vaccine now being introduced into Africa, the dengue vaccine. So I think this is going to be a new battleground that we have to look at. As we advance introduction of new vaccines, we have to anticipate that a big chunk of the anti-vaccine movement will come along with it.
We've got about 10 minutes that we're going to use to wrap up. I'll just some closing comments from my side, and then I'll turn it over to some of the panelists here to provide some closing remarks, and then we'll let you go to your next event. What's really clear is the way forward is together. There's no question about that. Not one entity in this represented in this room, not one country can go this alone. The issues are complex. They're often really local. And for that, we need local solutions that are tailored to that specific context. And I think what's also clear is this is not an issue that's going away. This is not a blip that we're going to get over and we're going to sort of go back to an era from a decade ago. And we each have a part to play in committing to solving these complex solutions, especially around demand, confidence, and hesitancy. And we've heard here how deeply linked those are to the services that are provided, the quality of healthcare workers, the training, and the actual provision of vaccines that are of high quality and that people want to get. So I want to just describe a little bit at WHO that we are leaning forward on leading and convening on best practices around vaccine hesitancy and demand, and especially on how to measure it. I think that's one of the key things that we really don't know how to track this, nor how to have measurements that have some validity around predictions of what people will actually do with respect to vaccinations. I think we have to remember this very firm link between confidence, demand, and hesitancy and the kinds of services that every government is providing to their communities and the whole range of communities. We haven't spoken about vaccines across the life course, but I think we shouldn't forget that adults, either older adults or parent-age adults, when they understand even the vaccines that they should receive for their own health, are more likely to actually seek vaccines for their children. So we have to remember, Peter, that vaccines do not cause autism. Vaccines actually cause adults. So one of the key things that I want to highlight for you, especially as you walk out of the room, is we're coming to the end of the decade of vaccines, the strategy from 2011 to 2020. We're in the process altogether of standing up a new strategy for the global community, for all of us, all countries, all partners, all initiatives. It's for all of the agencies, all of the CSOs, all of the community organizations and technical agencies. It's for everyone, both within immunizations and outside the immunization community. And I think this strategy has deeply heard that message and is really absorbing that. So we have launched draft 0 of the document. I'll just highlight the flyer that's going around the World Health Assembly to indicate how you can get draft 0, how you can provide comments, input, and this will move on to a draft that will be more finalized in the fall and will be presented at WHA next year. So we will all be back here with I'm sure, a very robust discussion on that. We are leaning forward, especially on the behavioral insights, on vaccine hesitancy, and we look forward to each of the convenings and the igniting of work around this area, and you will see us moving quite rapidly forward on some of these issues from WHO. So with that, I would like to thank you for being here, and I'm going to turn it over to 3 closing speakers, and then we'll let you go. So first to Secretary Azar, please.
Well, thank you all for being here today, and I'd like again to thank Commissioner Andriukaitis and Minister Mandetta for co-hosting this event, and Dr. O'Brien, thank you for moderating us on time, and to the World Health Organization for naming vaccine hesitancy one of the top 10 global threats for 2019. We've enjoyed hearing from the diverse set of perspectives represented. We hope everybody's benefited from today's discussion. I hope that this exchange has inspired each of us to return to our work in our nations or at our international, non-governmental, or private organizations with a renewed sense of commitment to promoting vaccination. I want to highlight two particular areas for action going forward. First, we look forward to ongoing collaboration with all of you on the development of a new global vaccine action plan to follow the plan that concludes in 2020. Second, I encourage all of you to develop in-country strategies to elevate vaccination coverage with efforts that meet your country's unique needs and challenges. Today, I was particularly interested to hear our discussion led by Dr. Tam and Dr. Berkley about social media interventions that we could all be trying, in addition to the importance of modifying social norms as a means of increasing vaccination and thinking about behavioral economics as what influences people's behaviors. Back home, I'm committed to continue leading efforts across the U.S. government to raise vaccination rates within our own borders. I also encourage everyone to focus both our global and national work in this area on outcomes. This is an area where outcomes aren't so hard to track or understand. I think the gentleman from Nigeria focused our efforts around metrics, that what you measure is what you get. Are our vaccination rates high enough to keep our population safe, and are they going up or going down? Today, we are seeing unacceptable results on these measures, and I hope by the time we see each other next year, we will all have some positive outcomes to report. So thank you again for this productive discussion, and I look forward to ongoing cooperation with all of you.
Let me now ask Commissioner Andriukaitis to give us some closing remarks.
Thank you so much. I have listened with great interest to these stimulating discussions, and in my 5 years I saw a lot of people who were against vaccination, and then after some process they changed their mind, being progressive and being in favor of vaccination. It means that progress is possible. And let me start by saying there's a strong level of expertise, of commitment, of political will here today encourages me and gives me hope. We have a lot of work to do, but we had work, but with hard work comes high reward. Our citizens trust us as healthcare workers and health authorities to protect them from disease and infirmity. Immunization has to be a priority for our health systems, a fundamental part of primary health care, a crucial component of every health care package. And we need to work together to share learnings and best practice, to coordinate and collaborate and combine our political effort. It is with these goals in mind, the European Commission and the World Health Organization are organizing a global vaccination summit on 12th of September in Brussels. This summit aims to boost political commitment towards eliminating vaccine-preventable diseases. It seeks to engage us, the political leaders, and identify opportunities for immediate impact on increasing vaccination coverage. I hope to see you all there in Brussels in September. Thank you.
I see that DG, welcome. You have impeccable timing. We have just a few closing comments from the Minister of Health from Brazil, and then I'll turn it over to you, DG, to share your thoughts with us and close the session. So thank you.
Well, thank you, our Director, Dr. Tedros, for coming. And I'm sure that when you stand for vaccination, you have the total name and status of the World Health Organization to call all the countries to come together. This is not a single country problem. This is not an easy problem. Although we say primary care, we should call it high complexity care, because this has something to do about how people think and how they receive the instructions of their parents and the physicians and everybody that works on vaccination and health systems. I'm sure that on the next year we might have many good works like the ones that was said here by Spain, and other countries that I'm sure that can support other countries' initiatives. And Brazil is committed to raise our vaccination rates and urge to call all the international partners like PAHO to work in Venezuela and in countries that on the region that are having trouble to do their jobs inside their countries. So you may count on us, and we count on you to bring truth for people and have a good vaccination year.
I just came from memorial service for Kofi Annan, and he used to tell us a story about Excellencies, ladies and gentlemen, thank you for allowing me to speak here today, even if I can only be here for a short time at the closing. Vaccines are one of the best investments in a healthier, safer world. Every year we estimate that vaccines save at least 2 million lives. Countless more children avoid debilitating diseases, prolonged hospital stays, and time out of school thanks to vaccines. Vaccines not only mean lives saved, they mean lives lived. They help children become healthy adults. But despite progress, more than 1 in 10 children around the world still do not have access to vaccines. Most unvaccinated children live in countries affected by poverty and conflict. They are in the most marginalized communities or places where health services do not yet reach. Recent measles outbreaks have occurred even in countries where access is high, but where drops in immunization coverage have threatened hard-won gains. No country can afford to be complacent about immunization. In some communities, vaccine hesitancy is intensifying. Some parents are delaying or refusing vaccination because they are not sure that vaccines are safe or because they doubt the value of vaccines. We welcome initial steps taken by some social media companies to stop the spread of misinformation about vaccines. But this is not simply an issue that can be managed online. Government, health workers, and health authorities have a vital role to play in building health systems that parents trust and believe in. Governments must invest in immunization and make sure primary care services are affordable, accessible, and responsive to parents' needs. Health workers must be empowered to be champions for vaccination so they can engage effectively with the parents and communities they serve. Education partners must work to strengthen basic scientific literacy and ensure people can interpret and understand information about their health and vaccines. And health authorities should undertake positive communication efforts so that people are engaged effectively on vaccines and the disease they prevent. To do our part, WHO, together with partners, Gavi, Seth, and UNICEF, is working to ensure vaccines reach more people in more countries than ever before. We're proud to be part of a new hub for vaccine confidence and demand, which will generate critical evidence and recommendations in this area. And critically, we look forward to working on the new global vaccine strategy, which will be presented at the World Health Assembly next year. The new vision contained in this strategy must be much more flexible and innovative to address new challenges like vaccine hesitancy, and it must better tackle old challenges like inequality and lack of access, and redouble the commitment to our collective goals. This will be critical for assuring that polio eradication is sustained, for getting measles goals back on track, and ensuring that everyone everywhere can benefit from vaccines. Vaccination is a right and a shared responsibility. It will take long-term efforts, political will, and continuous investment to ensure we are protected together, because there can be no health for all without vaccines for all. And I join my friend Vytenis in inviting you to join us in September in Brussels. That will be a paradigm. I think that will bring a paradigm shift and open discussion. Thank you so much.
Thank you.